Okay, we're ready.
All right, thank you so much, Adam. Well, first of all, hello, everyone. Thank you so much for being all timely and everything, just not in a wire, we made it. Too many meetings back to back. Adam, can we get a roll call, please?
Of course.
Oh, sorry, yes, we're starting. House Bill 3610, Task Force on Alcohol Pricing and Addiction Services. Thank you.
Senator Solman,
Here momentarily, he's not online. Or we'll excuse her for the moment. Isn't that her?
oh, there she is.
Yeah.
Pick her representative. Senator Canope, Chair Sanchez,
Present.
Representative Reschke, Chief Doug Barrett, Vaughn Berry, Rob Corbett,
Here.
Annalise Dahl,
Here.
Jamie Floyd, Dr. Tom Jean,
Present.
Todd Jeter,
Here.
John Colmer,
Here.
Sarah Lochner, Jana McCamey,
Here.
Director Prince,
Present by video. Hi, everyone.
Marcus Reed,
Here.
Jason said he'd be late. Danelle Romaine,
Here. And Jamie Floyd is in DC and won't be here today.
okay, thank you. And Solaris said she won't be here. Aaron Sarnoff Wood,
Present.
form is present.
Okay, folks. What's going on today? First of all, let me just say, we are. Seriously, people. I have a graduation at 2:00 that I thought was at 4:00. So I'm going to bail on you at 1:30. And we've gone through sort of the stream of things. Senator Solman is not gonna be, she's gonna be online. Everybody else is gonna be online. So I've asked Annalise Dolph if she could take over and share the rest of the meeting for me while I head out the door, and I'm going to be online for as much of it as I can be. But my apologies for that. Again, not something I actually. I had 4:00 in my brain, and I don't know why I said, sure, I'll be there and everything, open up, blah, blah, blah. Okay, so we're gonna start there.
And Chair, just one note that this is all being recorded, so
Yes.
you will be listening and watching
Yes,
this later on.
yes,
So it
Yeah,
doesn't
please.
limit the conversation today.
Absolutely not. Also wanted to discuss a few things about the work plan and some of we talked last time about some, the additions of a couple of pieces. wanting to make sure that we talked with the economists and, some folks around just the whole structure of things, policy decisions that we could possibly have around the distribution of tax revenue, increasing tax rate, blah, 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 all of those things. That was scheduled for July 18th. Okay, and we have 3 presenters. Let's say his name properly.
Madden.
Mazen Malik, David Jernigan, and Frank Chalupka, the University of Illinois in Chicago. And my understanding is that man has a very long presentation. So that's going to take up quite a bit of time. We also then have some other additional meetings. We have them scheduled. You should have all received them, even though we didn't schedule them out necessarily as actual meeting times. But there are additional meetings to finalize some recommendations from stakeholders and scheduled for August 1st and or August 15th, depending on how long we will go through just all of the detail. Now, just reality, I am not going to be there for some of that, just because I'm not the first, at least. I could be there for the 15th, but I can't be there for the 1st. But that does not mean that other folks cannot share and move this process forward, and then I can still watch online as, or eventually watch online as we get to it, so. Yeah, and then, we have our August 29th meeting. This is the discussion of draft recommendations and final report, and then, of course, the final report due in September. I just wanted to roll that out to y'all again, so everybody's remembering kind of where we're at and what we're doing. Okay.
Chair Sanchez. I don't love those meetings, and I'll tell you why. It feels like we're sort of being set up for an adversarial conversation where we have one side present and we dig at it, and then we present the other side, and we really haven't had any collaborative discussions about whether there's common ground. And so the idea that somebody like Dr. Jernigan, who's scheduled for July 18th, who has testified a lot in front of the legislature in favor of alcohol tax bills, who's all over the internet talking about the evils of alcohol, that just sets us up for a situation where we have to come in and do what we've been doing. We've already done this several times in this meeting, and I don't think it moves the conversation forward at all. So I just want to say that I don't see where this is going if it's just they say something, we say something, and we don't even know if there's common ground. So I respect the agenda. I will be here for the meetings, but I don't see that it moves the conversation forward to keep having this back and forth without maybe figuring out, is there any common ground? Because we know when we get to the legislature, it's either going to be us all working together on something or somebody fighting something that goes nowhere.
So my hope is that conversation is actually going to tell us, yes, I understand certainly from Jernigan's perspective that feels really harsh and that it is difficult. But also I'm very concerned about the actual, what does this look like in real life, right? And I think I've made it very, very clear. It is not my intention to damage the industry. My intention is to deal with the lack of resources that we have for particular things. It was never my intention to raise taxes, this massive amount or the presumption of this massive amount that it would have been, with past bills. As I said, opening salvo, let's have the conversation. Let's start to talk about it. That's what I want to do. I hope that we can get to a place where we can have those open conversations. It's unfortunately we're bound by time in some instances, but that's why part of the conversation in August will be about, what do people have? What's your suggestion? What are you thinking? What could we do? How could we do this differently? I mean, I've had conversations with folks just about one of the biggest issues that comes up for everybody, I feel like, is anytime we do an increase in taxes, do we know where it goes? And that's been a part of the biggest part of the conversation here. How do we narrow that and make it, in my mind, gas tax tight, right? That's how I want it to be, literally gas tax tight, to where it goes for the specific things that we're asking for, right? I don't want us to, well, let me just say that then. No ideas off the table at this point, okay? And I'm willing to hear what lots of people have to say. I think it's important that we have those conversations.
Sure.
Well, and I was going to say something similar to Janelle, but I guess I was looking more for if there's going to be sometime soon, and I was hoping a meeting, maybe before we get more presentations, because I feel like we've had a lot of people talking at us and we haven't really had a lot of time to talk as a group. And I would really love to like walk through the bill and the things that we're supposed to answer from the bill and figure out like, have we heard about this? Do we feel like we have enough information to actually proceed with answering this question? Or do we need to have additional presentations to actually bring people up to speed? Because I mean, a lot of folks around this table know their side of the industry. I feel like we've had 11 meetings now where we've heard about kind of the other side of the issue. And I am just a little, I think this is our opportunity to talk as a group, and we haven't been able to really do that. So I guess I'm just requesting that we figure out a way to make that happen sooner rather than later. Because if we wait too far in August, then there's not time to actually answer the questions that we're supposed to answer in the report. So that's my take.
Okay, so we do have the June 27th meeting as well for the OLCC overview of agency. And let me just say, folks, my schedule kind of sucks, but I'm okay adding another meeting if you want to. I don't mind having a conversation. Because you're right, that is a piece that is not, we've not created that as well as possible. Right? We could have done better on that one. And you're like a herding cats sort of situation to get everybody in the room at the same time. So.
And share I hope I'm not speaking out of turn, but we did have an incredible discussion from the Oregon Health Authority, and it took up a lot more sessions than were intended. The meeting for June 27th, Director Prince could probably say something about this, but it's only OLCC presenting on that day. Said it might afford us an additional hour just to have that broader discussion.
That would be great. Thank you.
Yeah, it'll give us a little time, not necessarily as much time as maybe we would need, but again, happy to schedule more time if people want to make time to make it happen. It's a little bit difficult. I might, I'm actually traveling on August 1st, so I can't be here for that meeting, but that would be another opportunity for people to have further conversation. If people could be in the room to actually, have more conversation about it. I'm not the only, I don't have to be the one in the room all the time, so.
Would it be possible for us to extend the meeting on is it the 27th?
June 27th, that's what I was trying to look at my phone for, and then I saw shiny object. And I saw all the messages that have just come in.
And I will look over to my OLCC colleagues to determine whether there is anything else, Laura and Adam, on that date at OLCC.
Yeah, I can't do it, unfortunately.
Let me ask it this way. What is the purpose of July 18th, the presenters there? We got two people who are going to say things negative about alcohol, and then Mazen, who I love, but Craig's going to essentially say that information when he speaks about the OLCC, where the money's going.
Do we think that
Yes.
we do? I didn't get that impression.
So can I ask, I think I was not a part of some of this history, so I think I'm not completely tracking all of it, but I know for me, kind of that national landscape I do not understand the national, like I would like to hear about the national landscape and what's happened in other states. So is Craig going to present on that, or is who's going to present on that?
Craig, Director Prince, you can speak up, but I don't believe people presenting.
Well, thanks, Annalise. I was going to present, some of the things that have already been alluded to about, national liquor tax, wine tax, beer tax. So I was going to do that type of comparative. I wasn't going to get into anything beyond that as far as a national comparison. Does that help, Annalise?
Yeah, I mean, I think from my perspective, the two things that come to my mind are we haven't talked about that, and a big question for me coming out of the Eco Northwest report. I know we spent a lot of time on that, but it was a real open question in that report what the impact of raising revenue in this area would do to communities of color and marginalized populations. And feel free to correct me if I'm wrong, but like I seem to remember that was like a whole. So if like we can get that information somewhere And I think sometimes, for me at least, it's helpful, no offense to our Oregon Health Authority partners, but I think we have all been in this for so long. Right, like you said, kind of like sides, right? That like, okay, so what are, like, we're not the only people of beer and wine taxes, right? What have other states done? What have the effects been? Like, just having that information and what the impacts have been would be super helpful for me.
If I may, my concern, just with some of the presentations, I've researched both of the speakers online and found similar numerous instances of factual issues, claims that are not substantiated by data that I was able to find, and, you know, problematic anti-alcohol conversation. And again, you can disagree, but that is what I found a lot of, which with those two particular speakers, which is why we are concerned.
It's about perspective, isn't it?
Well, there's facts and facts, you know, so. Yeah.
That's true.
I mean-
That's true. That's very, very true. And unfortunately, you know, yeah, it's a little bit of a rough moment. So I understood that we wanted to hear part of this piece specifically about how tax was done in other parts of the country, how different things, what the impacts were. So I'm reluctant to remove that as an option, although we can have. We can certainly have some conversations with presenters about their actual presentation in terms of not allowing a level of disrespect that would be offensive. I think that, because I think sometimes we do, right? We can make presentations that are offensive to other people with intention, right? And that's not okay.
Can we add somebody to talk about the national landscape who's on our side of the issue, since the other side has a national, I mean, we don't have a neutral person telling us what the national landscape is. So I agree with you, that would be interesting if it were somebody who didn't have a dog in the fight.
You know, Jay, didn't we have a national
Yeah, we probably
alcohol
did,
industry
yeah.
presentation a couple sessions ago, starting out the session?
Yeah.
We had Lester, but we've had about 10 presentations from OHA who keeps telling us alcohol is bad. We've had 1 or 2 from our side. We had one specifically for folks in recovery. So it's been very unbalanced in terms of the industry people who've been presenting. And this one, if we're getting a national landscape, is again, just entirely the other side and not us at all. So it feels very unbalanced.
And it's for the industry to make sure that there is a balance, our industry balance discussion around that. An economist,
That's for
that's
August
the
1st.
August 1st, so potentially
Yeah.
a presenter that,
Yeah.
I believe for the other discussions, we've gotten the recommendations, so that wouldn't necessarily be closed off from the industry to have a recommendation of their choice.
It's there. I mean, we wrote it in for August 1st.
I know, but you're not there.
We can switch to
They
different.
don't have to. Well, I'm not there for August 1st. That doesn't mean I can't watch it online later on or something.
Can we add one speaker on the 18th for our side? Let me say, can we balance out the 18th?
I think we would require those folks to severely cut down their presentations if we did. And that's not the end of the world, because trust me, I've heard enough of something. So I think that's an option.
And we can have 10 minutes. I mean, it's just, can we provide a different perspective?
We can revisit that.
Let's revisit it and figure it out. Okay.
Thank you.
And I would say even just hearing people talk about it instead of talking at us, like just a conversation. I mean, if we have the 2 experts from both sides kind of going back and forth on kind of their view and why the other side doesn't think that it's accurate, that might be, at least it's a dialogue. I just feel like I would like some dialogue, I guess.
Okay. Well, let's do our best to get to that then. And I am so sorry. We are a bit behind now, folks. So hopefully we are good with this conversation at the moment. So We have Dr. Pat
We say Ludke.
Ludke. Okay, God.
Yeah, full responsibility for that name.
Yeah, yes. To present on the epidemiology of alcohol use. Sir, please.
Happy to do so.
And
Thank you,
again,
Madam Chair.
my apologies, I am going to walk out in about 9 minutes and we'll be connecting on my phone situation here.
Very good.
Yeah.
And can I look anywhere for the cameras for others online?
I'm not even sure. And then
What do you
again,
suggest?
reminder, no, I think you're fine. I think. Yeah.
And they can't probably see you anyways.
Yeah, they see the table, they see the table and they don't really, which is why we're supposed to be remembering to say our names prior to, if you, voice your members.
Very good. Okay, thank you. Pat Lepke, I'm a primary care physician and the health officer for Lane County, I'm based down in Eugene. And I'm here to talk to you from those perspectives and to share some of the data that we see in Lane County and give a bit of a local perspective and set the table for the other presenters today. Next slide, please. And I'm going to start with a story. And really, I've been in Oregon for 14 years, moved to Eugene back in 2010. And about a year later, our county decided to outsource the medical facility from jail. And about a year after that, the commissioners came to me and said, let's go find out if we're spending taxpayer dollars in a good way. Why don't you go assess, do chart reviews? And back when people were still on paper charts. So I'm doing chart reviews and such for behavioral health cases and for primary care cases at our county jail, which is a large facility, 500 plus beds. Pre-pandemic, it was always full. It's a little less full these days. And making sure that not only they were using taxpayer dollars effectively with regard to antibiotic prescriptions and these sort of things, but also the other assessments and risk with regard to alcohol withdrawal or other substance withdrawal, opioid withdrawals, and these sort of things. And next slide, please. What surprised me was the number of patients in the jail who had to be on an alcohol withdrawal assessment tool. It's called CIWA. It's the Clinical Institute for Withdrawal for Alcohol. And if your slides look similar on your computer as they do here, the top line is the number of persons brought into the jail each month. This is over 3 years. So it's all of 21, 22, and 23 for the Lane County Jail. And you'll see 650 to 700 people per month, 150, 160, 170 new intakes every month. So pretty busy jail. And the bottom line, which is orange on my screen, is the percentage of those persons who have to have an alcohol screen because of alcohol use disorder. And it varies over the years. Historically, it's between about 7% and as high as 20% at any given time. Over this 3-year period, it's about 10%, which might not seem like a lot, but the alcohol withdrawal takes place over several days. And typically the assessment done by the clinical person is every 8 hours for 5 days. So it's essentially 15 doctor visits over 5 days, which means there's less capability for them to do other things that's needed in the jail. And there's always things in the jail, right? There's accidents and injuries and primary care, vaccinations and things. So that surprised me a little bit and gave me a different view of the input and the outcomes of alcohol use in a carceral setting. That being said, alcohol is part of our culture. I was a Navy doc my first career, and when somebody gets a new rank, there's a wedding down. Whoever got the new rank gets paid more. You have to go buy beer for everybody. And that's just the way it is in the Navy. And it's part of the sacrament in the Christian church. It's part of our culture in many ways. So it was a new data point for me. Next slide, please. So I next went to work with our medical examiner. We're lucky that we're a large enough county that our county medical examiner is actually a state employee. So he does the autopsies and determines cause and manner of death for several counties, not just my county. And over the years, I've been able to do autopsies with him, and there's not a ton of cases that are directly involved with alcohol, but there's a fair percentage on the slide. So this is data from 2023. Our medical examiner, or ME for short, we had about 1,600 cases that fell under his jurisdiction, 113 of them with alcohol involvement, typically a toxicology report. And again, that number ranges from single digits to 10, 12, 14% in any given year. It varies a fair amount. It's also worth noting that, again, this is just the ME, the medical examiner case data. The medical examiner does not track all deaths from alcohol. He only has certain homicides and suicides and car accident deaths under his jurisdiction. But again, it was a data point telling me that, okay, we need some resources to address this in our community. And of course, what resources do we have? And I'll get to that later in the presentation. Next slide. So from that point in time, I started to look at youth alcohol use and what are the opportunities and what are the challenges there? And what is the data around prevention? And again, none of our data is perfect, but there are data trends that point you in certain directions of need and opportunity and areas to stay away from. Hey, it's working fine. People are using alcohol in this area in a reasonable manner. Next slide, please. So we have a survey in Oregon, a student health survey done, 6th grade, 8th grade, and 11th grade. And this is the Lane County data for 8th grade and 11th grade. And you can see there's alcohol and cannabis and other substances. And there's a fair amount of use. And this is the time of people experimenting. I had my first beer when I was in high school. Didn't like it, by the way, but I like wine. And this is a time where this is part of the culture. And this is where people are going to experience these sort of things. And we also have data at the local level to look at some populations who has the highest challenges with alcohol. And of course, persons of color in some groups have higher alcohol use rates and may get into challenges further down the line. We don't know that for sure. This is just, what we call a point in time study looking at where people are today. So again, this study goes on every couple of years. We have this data for county level viewing. Next slide, please. So statewide view, I'm trying to find a colorful slide for you. It can be, boring if these rooms without windows. Next slide, please. So state level, alcohol is not #1 cause of death. I think everybody knows that. It's not the biggest problem on the list for most primary care providers like me, but it does come into play from time to time. Tobacco is the #1 cause of preventable death in Oregon, and in fact, throughout our country, all 50 states. Obesity is #2, obesity including inactive lifestyles and poor diet. And alcohol is #3 in many states, including our state. There's a lot in the media these days about opioids and fentanyl. You can see #4 in Oregon for preventable deaths is illicit drug use. It's about 1,400. Roughly 1,000 of that is opioids. There are, of course, other ways you can die from illicit drugs. Cocaine is one that can cause death, and methamphetamine as well. But despite the fact that fentanyl is in the news a lot, alcohol deaths are a bit more than double in the state of Oregon. Next slide, please. So just 4 data point slides. I know that you have seen presentations from others, and it was nice to hear this preamble conversation of what you've heard before, and I'm not going to dig deep into the data. But we've seen, an increase in per capita alcohol consumption in Oregon and the US over the years. What does that mean? There's always reasons behind this, and you are always right to torture the data, which we try to do as medical epidemiologists ourselves. Next slide. In parallel to that, we've seen an increase in alcohol-induced deaths as well as alcohol-related deaths in the state of Oregon. These are 30-year slides. And this data, again, has to be interpreted. Again, we try to torture our data as much as we can. This particular slide is up to 2021. So only 1 year of the pandemic, and big events like pandemics and other stressors like 9/11 can sometimes change people's outlook on life and behaviors as well. Next slide. And this is the alcohol-related deaths. So the induced deaths are direct deaths from alcohol, like alcohol poisoning, which are pretty uncommon. And related deaths are others, typically accidents and injuries that might be related. So
Sorry, just a question if I may. Aaron, sorry, on 2 towns. This is derived from the RD tool, correct? This is not actual measured deaths, but estimated deaths from the CDC RD tool? Okay, thank you.
So this is the related deaths, capturing all the other impacts potential of alcohol.
Is a source Oregon death certificate?
So
It's not estimated?
OJ, the alcohol-induced deaths are the ones that are directly attributable to alcohol. Those didn't directly death certificates. The alcohol-related also includes a lot of other complications based on medical studies, but ultimately it's coming from.
Okay, so I feel like you need to either clarify for Aaron.
So if I may, the death certificates don't say alcohol, they say things like throat cancer. And the state chooses, or the CDC chooses to apply a certain percentage of throat cancer deaths to alcohol.
Well, there's truth on both sides, right?
Yeah.
Because I complete death certificates, and sometimes you do put out.
Certainly there are those that do say alcohol,
But you're correct, that sometimes you don't.
Yeah.
So, because you don't always know.
and in this, I believe 55% are estimated rather than.
Yeah, and it's estimated based on, peer-reviewed academic research as to what, what is the proportion of the attributable fraction of throat cancers throughout the census and fraction.
I just want to suggest this for my mind. We love to debate.
Yeah.
This is-
Thanks for
Yeah.
at the end.
You have no idea what you're walking into if we can, maybe Dr.
All
Lexi.
right, next slide. We'll go quickly. So, the most, in the public health side of my job, the area where we're most concerned is binge and heavy drinking. And, this is the graduation time of year. There's probably going to be some heavy drinking this time of year, college, high school, whatever it is. And the vast majority of people will not run into a problem, but a small percentage will run into a problem if this is persistent behavior. And we've seen an increase in binge and heavy drinking. We have several different surveys, both at the state level and the local level, that show it's an increase. And it's a concern overall, but for a small number of people, right? It's not a large number of people, but it does add up. Next slide, please. So Lane County alcohol use data around adults. We have a fair amount of this data available for Lane County. We, again, are thankful for the behavioral risk factor surveillance survey data. And this is broken out by Lane County. And again, we're lucky to be a fairly large county. So we can reach some statistical significance because of the size of our county, as opposed to some of the smaller counties with 2,000 people where it can be hard. So on the left-hand side of this slide, you can see the percent of Lane County residents age 18 and over reporting use in 30 days for heavy drinking or binge drinking, female and male. And you can see there's a little difference between female and male. People can identify that way. And on the right-hand side, you see the percentage of the Lane County residents 18 to 34 reporting use in the past 30 days by sex, given in a different way, from 18 to 34. And again, this is what we call BERTHIS data, Behavioral Health Risk Surveillance Survey, which is a national tool, but done at the state level. And sometimes we expand at the state level for areas we want to learn a bit more. OHA will put some more money into it, and there will be more sampling across larger populations. Next slide. So I want to finish with, again, going quickly, just a couple local observations. So this is a copy of the document we get in the mail that shares the amount of alcohol tax money that comes to Lane County. And in 2023, that mental health tax distribution, which I'm sure each of you know much more about than I do, was almost $300,000. For several years, our split was 75% of that money going to providers, for providers in the substance use, alcohol use disorder space, and 25% going to our prevention team. And 25% of $288,000 is not a lot of money, and it's hard even to hire a full-time person to run a prevention program that works with schools and colleges and such. So we renegotiated that, and we went to a 60-40 a few years ago. And the split last year, you can see about $175,000 of our local money going out to providers, $113,000 going out for our prevention work at the population health level. And that still remains a challenge to keep that program up and running with the challenges we see in the community. So I think one of the needs that I hear from my prevention staff is more resources in this space. And where can those resources come from? Some can come from the alcohol revenue, some can come from other general fund resources in the county, which of course requires commissioner approval. Next slide. Final data point, we have a Lane County Health Attitudes Survey we've been doing since 1998. It assesses thoughts and beliefs in many different areas. There was an alcohol question that was added some years ago. And the question around will Lane County residents support increased taxes on beer and wine if the money would stay locally, about 70% in the 2022 survey would support that, which is fairly high, I think, and it has gone up a little bit over the years, but relatively stable. The 94% of the respondents think that binge drinking is a problem in the community, whether it's for their family or for the broader community at large, and that's increased a bit over the last 6 years as well, from 2018 to 2024. So I think our community is fairly well aware of the challenges and interested in making sure that we address them in a way that makes sense. And I'm going to summarize my last slide and go to the Q&A, which is just 3 points. We've been seeing over time an increase statewide and Lane County as well in alcohol consumption and binge drinking and alcohol-related deaths. They've increased over the last decade plus. Binge drinking and heavy drinking is the biggest concern to us, again, because alcohol is part of our culture in many ways. And most people use alcohol in a reasonable way that doesn't put any excess concerns on the community or on their families. And then finally, we do struggle at the local level with public health funding for prevention. And it's an ongoing concern in Lane County for sure. And I'm the chair of the Health Officer Caucus, and we have 33 local health departments in Oregon, and I'm the president of the caucus for the health officers, and I hear this from our other health officers too, that, it's an ongoing challenge, and what can we do to meet it? I don't know the right answer to that. That's why you all exist, to figure out the right answer to help us increase those resources, but we are struggling in that space. Happy to take any further questions or comments.
Thank you, Aaron.
And starting off with Two Towns Cider, just a couple of comments. A number of those slides were OHA, I believe, was the source of those slides. Binge drinking rates increasing, that we've already covered. Those were comparing different methodologies. If you look at the BRFS system now, there isn't an incline in binge drinking. It's been relatively stagnant for the last decade. Same goes for consumption. Ended in 2021, 2023 saw a steep decline in consumption after the pandemic, bringing our current consumption rates below pre-pandemic rates. I think there was one more. There was a couple of slides there. I apologize, but we have addressed those in past meetings.
Yeah, Tom at OHA, we haven't had this discussion before, and just to clarify from the OHA perspective, based on the facts, we had, for the first point about Burvis, we had a methodology change in 2010. And prior to 2010 in our data, there's a clear upward trend. After 2020 or 2010 to the present, it's a lot more stable. So it's relatively flat, but possibly a slight increase there. Whether it's, it is a slight increase, whether it's significant or not is a question. So yeah, I don't think we need to go through all these questions we have.
Danelle.
Hi, I'm Danelle Reading, the Oregon Beer and Wine Distributors Association. Thank you for your presentation. I'm curious whether Lane County or the Counties Association has ever gone in to ask for a larger percentage of the money from alcohol. It's the third largest source of revenue for the state. There's a lot of money collected. And I see you ask about beer and wine, but not about liquor in your public health surveys. I also wonder why not ask about the county advocating for getting more of the liquor dollars? Why just focus on beer and wine if it's an alcohol thing? So curious what you've done in terms of your advocacy. I know you have in-house government affairs professionals.
I wish our long-serving lobbyist just retired, and tried to ping him beforehand. You probably know Alex Tyler. Yeah, we haven't replaced him yet. So we have done our internal conversation. That's one of the reasons I had the slide in there, going from the 75-25 split to 60-40. And I think I'd leave it to one of our intergovernmental relations persons to talk further about that. That's what they do.
And Sarah Luckner with Clo. I can add to the liquor tax is divided up amongst different recipients. Anytime you ask for some more, it has to come out of somebody else's pocket. And so it's a very difficult conversation to have to say we're more worthy than law enforcement or we're more worthy than OHA. And then you have a gap in somebody else's budget. So it's a difficult conversation to have, and it's an uphill climb politically.
If I may respond to that, Aaron, starting with Two Towns. It was my understanding that roughly 300-ish million from the alcohol taxes went to the general fund, not to any specific budget. And the general fund, we have a $5.6 billion refund surplus. So is that true that if that section, that 300-ish million that's going to the general fund, couldn't you allocate out of that section and not impact anybody else's budget?
That's a great question. I wish Representative Sanchez were here. I don't know if Craig can answer that or anyone.
Right, we can't speak on behalf of the chair, but
Craig?
Yeah, I certainly can't speak on behalf of the chair, but I think, again, I guess I think this is an important area that I'll try to clear up next time. But I think what we're getting to is the predominant distributions of liquor and alcohol revenue from OLCC are unrestricted. In other words, the general fund is 56% of the proceeds. I think the county is 10% and the city is 34%. Sorry, I don't have my cheat sheet in front of me, but I think this is going to come up, and so just want to make clear I think the doctor's presentation showed the letter. I think he's looking at the specific one. I think Dr. Tom from OHA. And then the others are unrestricted, and that means that the local county commissioners or the city mayor and the city managers are making that decision, much like Chair Sanchez, excuse me, would make that decision for the general fund. I hope that clears it up. I think the doctor's looking at the one earmarked section and not the unrestricted distributions to the state, the city, and the county.
Thanks, Director Prince, and certainly want to recognize, Dr. Lickey, that you are just one person from Lane County and that you're not speaking on behalf of all of the counties everywhere. To be fair. Any other questions before we move on?
One quick question, Aaron, sorry, 2 We heard in our last session that there was potentially issues from county expenditures finding federal matching dollars when those are available. So when they're coming from the state level, that if that's easier to obtain. Do you have any information on, federal match funds for your county? And, is there any process that Lane County takes to try to maximize what those might be?
I don't. I know we have federal matching funds in a lot of areas, whether it's Medicaid, Medicare, et cetera, but I don't in this area.
Okay, thank you.
Okay, I think Jana is the last one, and then we can move on to kind of keep us on time.
Hi, thank you. Jana McCamey with the Oregon Wine Growers Association. I just had a follow-up on that distribution question. This is maybe more for Director Prinz. Are you going to be digging into more of this detail in the OLCC presentation? Because if we look at the statutory remit of this group, we are supposed to be looking at that distribution and discussing. Completely understand it's a politically fraught process, but I think it is one that we need to have enough time to really dig into and look at and see if there isn't more that could be done with the existing resources that are there. So I'm hoping we have ample time to really talk that through at the OLCC presentation.
Yeah, Jana, thank you. Just Annalise, if I can just respond. Absolutely. What my presentation will be focused on is the control model and then how we set the price for distilled spirits, the definitions for the different categories of alcohol, and then the distributions on each of those. And Jenna, you're right. I think it is in our charge to look at the distribution of those proceeds. And I'll just say that, right now, just to clarify again, it's unrestricted. So that means that the county, the city, or the general fund make those decisions. As a editorial, as the talking to our commission and as the control agency, I'm starting to see why those earmarks, we don't make those earmarks. We're not the experts on these different issues that I feel like some of you all are, and some of us have tried to become. But definitely that will be the bulk of the presentation for us on the 27th. Thank you.
Thank you. Thank you so much, Dr. Lepke, and I assume you're going to stick around with the rest of the folks, so feel free to pipe in later. If we can turn to the county revenue picture, I think Tyler Stone from Wasco is going to kick us off.
Yeah, and I'll be brief. Thank you, Chair. So can I share my screen?
Yep, I think they're keying you up.
The screen.
Are you going to be sharing the presentation from your end, or would you like me to pull it back up?
No, actually, I have just a couple of slides, and then you've got the rest of the presentation there.
Okay. Sorry, so to be clear, you want me to pull it back up then?
No. Let me grab it here. So can you see that?
Yes.
Okay, great. So a little bit of context, I think, really needs to go into this because we're all a little bit differently, and we all address these issues a little bit differently. And so the revenue that you're looking at here on the screen is really just within the county's general fund. But what's unique about us is we actually have formed ORS 190 agencies to handle a large piece of this. And so with me, I've also got Al Barton, who's the director of Mid-Columbia Center for Living, that handles a lot of the substance use, and those dollars will flow through that agency. And so Mid-Columbia Center for Living is owned by essentially Wasco County, Hood River County, and Sherman County. And likewise, we approach public health the same way in partnership with Wasco County and Sherman County. Our jails Norcor with Sherman, Hood River, Wasco, and Gillum counties. And so there's a lot of different funding streams and a lot of different dollars. But we're just looking at Wasco County. This is what we're looking at per se. And so Wasco County, we've got about 35,000 people, large land mass acreage. But you can see over time here for cigarette, liquor, and marijuana, we're just kind of treading water or reducing, especially on the marijuana side. I was asked to show what the impact was for the Measure 110 reductions. And from here, our marijuana actual tax is this blue line. The loss due to the 110 cap is the gray line. And had things stayed the same for 19 and 20, that's our orange line, right at about $120,000. And I'll get into those percentages here just shortly. So a percentage, so I keep hearing, how are they used? How are they used? So that little bit of money that Wasco County is receiving, not inclusive of the other agencies that I just talked about, we distribute it out in about these percentages based on the percentage of, let's just say, substance use disorder calls for service or activity. And so for our sheriff's office, that's about 30% of their time or 50% of service calls. And for our district attorney's office, that's about 25% of the cases. And so on these three funding streams, if you're looking at the combined amounts, you're looking at very, very small percentages to make up a piece of that budget to respond to these types of issues. Just kind of bouncing down through, we have some dollars that are coming in. We do send some direct funding to Mid-Columbia Center for Living out of our general fund. We also fund youth services, Youth Think, and then again, that about 25% of the sheriff's office load and 25% of the DA's office load. But this blue line, this top blue line, this is really those SUD costs that are not covered in Wasco County. And Wasco County funding as a percentage of service. So again, cigarette, marijuana, liquor, and that's the totals. And I'm just trying to get across that, you know, we were in 2020 up here at around 20%, and we've just continually been dropping. And so that's what those impacts are. Now, I do have with me our sheriff and our juvenile director, Molly Rogers, and Al as well from MCCFL. If there's any questions as to the revenue picture for Wasco County or those agencies outside of Wasco County.
Thank you so much, Tyler. I think we're gonna hold off for the other Wasco County folks until we get to the portion about the behavioral health services, if that makes sense. And so I think from Deschutes gonna present on the revenue.
Thank you. I'm Eric Kropp with Deschutes County. I work as Deputy County Administrator. I have a handful of slides. If the person running the AV can run them, that would be helpful.
Okay.
Might take me a while to figure out how to share my screen otherwise. Great, thank you. So that's who I am. Go to the next slide, please. This first slide talks about marijuana tax revenue from fiscal year 18 to fiscal year 25. If you add that up for Deschutes County, it is about $1.6 million. And that is allocated to several different county departments in the sheriff's office. The sheriff's office has received about 51% of that revenue. And the sheriff's office uses that for a detective position that works on marijuana grows. It was 2 positions at one time, and now it's just 1. 20% of that funding has gone to our community development department. That's been used for code enforcement and also planning services. And then 28% of that has gone to our health services department for both prevention and treatment. And then about 1% has gone to our community justice department, specifically our juvenile division for substance use disorder training for staff. I will mention that the marijuana tax revenue comes into the county based on some recent legislation. There's a cannabis advisory panel that makes recommendations to the Board of County Commissioners on how to use the funds. So far, the recommendations from the Cannabis Advisory Panel have been implemented each fiscal year for the marijuana revenue coming into Deschutes County. Next slide, please. With the reduction of marijuana revenue due to Measure 110, the impacts to Deschutes County is that the marijuana detective is only partially funded. The other costs are absorbed by the sheriff's office budget. Our sheriff's office has 2 taxing districts for property taxes. So the taxing districts are basically or essentially subsidizing the marijuana detective costs. Also, community development, code enforcement is now only partially covered. And then there's been less funding for health services prevention work. So the demands for those services remain, and rather than reducing or cutting them, the county has continued much of that work. Next slide, please. Now I'm going to move over to the alcohol tax revenue. This is looking at the first bullet point, talks about fiscal year 22 and 23 actuals. The unrestricted alcohol funds comes into the county's general fund. That's about $1.6 or $1.7 million. That comes into the county's general fund and is not segregated once it gets into the general fund. And then there's a portion that goes specifically to our health services department. Janice Garceau, our health director, will talk more about those funds, but those are the restricted funds. In general, county general fund goes to support community justice, which is both adult parole and probation and juvenile. Our juvenile division receives about $8 million in county general fund currently. Health services receives about $7 million of county general fund. The sheriff's office does not receive county general fund, but they receive transient room tax in the amount of about $3 million. And then our district attorney's office is in the county's general fund, and the current cost of that is $12.8 million in county general fund. So although you can see that $1.7 million comes into the general fund, it does not go directly, those exact funds don't go directly to those departments. That's some of the cost of the county's general fund to operate those departments listed there. Next slide, please. We've been facing realities of not necessarily declining county general fund, but what we found is that our general fund, even though it's growing, the expenses are outpacing revenue, like many local governments and school districts. The county's general property tax rate is maxed out, as is the county's, the sheriff's office, 2 taxing districts. The sheriff's office has a countywide taxing district that supports countywide operations, such as the jail. The other taxing district from the sheriff's office is just for the rural or unincorporated counties. That tax district does not apply to residents within cities. And that taxing district goes to support detectives and patrol in the rural county. And so what we're seeing is an increasing pressure not only on county general fund, but also the transient room tax, because the sheriff's office, as I mentioned, receives about $3 million. So the benefits of discretionary dollars for the county is match funds, addressing gaps, and investing in local solutions. That concludes my portion of the presentation. Next will be Janice Garceau, but I would like to see if there's any questions.
Aaron, Two Towns Cider, you mentioned reductions in funding. Those are from taxes, presumably from alcohol sales. Are you seeing reduced alcohol sales or reduced marijuana sales, or what's causing a reduction in those funds?
We don't see the nitty gritty of that. We receive the funds from OLCC. On the marijuana side, it was the marijuana revenue went down because of Measure 110. We also had 1 or 2 years where we did not receive that revenue because Deschutes County opted out of new cannabis businesses. On the alcohol side, I think that if you look over time, we've seen increases, but it's not covering the cost.
One follow-up question related to Measure 110. You indicated that cut funding for some of your substance use treatment, but wasn't the Measure 110 intended to divert those funds specifically for SUD treatment? I mean, I thought it moved $250 million into that bucket.
It did. I mean, when we first received the marijuana revenue, we were using it for the impact to other departments, such as the district attorney, or such as the sheriff's office, community development, juvenile justice.
Thank you.
Are there other questions for Tyler and Eric before we move on? One. Okay, then Janice, we'll turn it over to you.
Okay, I'm going to skip my first 3 slides because they're really a local picture of the same data sources that I think are being discussed, and I don't really have a dog in the fight about whose data exactly, and I use the data that's available to me. So I'm just going to move past those. So I'm going to go to the slide that starts with critical gaps. But by way of introduction, I'm Janice Garceau, I'm Director of Health Services. I am a 35-year, can't believe it, social worker, licensed clinical social worker. Until about 8 years ago, I provided direct services. And I still frequently end up in the field alongside my staff when I'm curious about something and want to see what their work looks like. I am German. I was raised in a family that had wine at the dinner table every single holiday from the time I was probably 9 years old on. I have a family not afflicted with addiction, but I have watched people close to me die from alcoholism and other kinds of addiction. So again, I've seen the whole span of how alcohol shows up in people's lives. Proud of Oregon's tradition of breweries and wineries, love living in this state. And I am not here in an advocacy role, which is unusual for me. I'm usually in an advocacy. I'm just here to talk about what it looks like on the ground in our community and how we're making use of resources. So we are experiencing some significant gaps in resources for, in particular, youth substance use disorder prevention, youth substance disorder treatment. There is a significant dearth in resources for that. As Eric mentioned, I think common to many counties across the state of Oregon, what we're seeing is increasing costs, and those are mostly driven by wages and by healthcare costs for the public sector, and revenue just not keeping pace, whether it's tax revenue, whether it's financial assistance from the state, Medicaid, anything. It tends to not keep pace with what's been increasing and increases in costs. So on this slide, what I'm really pointing to are some of our critical gaps in the area of prevention. So our public health department, which I oversee, in addition to our community mental health department, has received $100,642 a year for over a decade targeted towards drug and alcohol prevention. That equates to a reduction every single year. At this point, that doesn't cover it. Prevention activities, nevertheless, because of our commitment to doing that work and because of grants that have become available that we piece together, have been supported by cobbling together other resources. The problem is that those are often one-time dollars. They're often, they come to us with very specific requirements around allowable uses. An example would be tobacco tax dollars. You can use it this way, you can't use it this way. Opioid resources, very similarly. So while we've had some prevention resources come in, we often are not in a position where we can be innovative, creative, or responsive immediately. And rarely are we able to cover the indirect costs of providing these services out of public sector setting. Recently, the good news is that the Opioid Settlement Board identified $9.5 million for SUD prevention, partly in response to, I think, some great advocacy on the part of CLO. I have to say what the acronym for CLO is.
The Coalition of Local Health Officials and the Alcohol Drug Policy Commission.
Okay. Oh, great. Thank you so much. So that's all, at this point, it is a one-time biennial investment. And if I sort of look at historically what that actually means in the dollars that come to our community, it's somewhere between $300,000 and $400,000 and some odd thousand dollars over a 2-year period. So while we are enormously grateful, I would not call it the level of investment in prevention that I think our current state of use and impact in the community would warrant. Next slide. I mentioned that there are critical gaps in treatment. We have a pervasive, long-standing shortage. I am sure this group and others have heard about where Oregon stands in terms of access to substance use disorder treatment. It is particularly concerning for youth. We have one residential youth facility in our community, which serves not just Deschutes County, but the Central Oregon region. And it has had 20 beds, but really has not even been able to operate at that level since the pandemic because of all of the issues that the public behavioral health and substance use disorder sector has had hiring staff. So very limited resources for youth for experiencing addiction in our community. Measure 110 investments were a huge help. And I think there was great advocacy at the OHA level and at the legislative level to ensure that when those resources shifted from the sort of more unrestricted distribution to counties to very targeted investments in the community, there were some good conversations about that, including not reducing other sources of behavioral health dollars and investing in communities. The good thing about those investments is that our community received $12 million. Our Central Oregon region, or Deschutes County actually received $12 million. That went to a number of providers. It is for very specific uses. It did not add treatment beds. It did add intensive outreach and engagement to a very specific population of individuals who would have been incarcerated because of substance use, right? So it was very targeted. We're very grateful for it, but it's not like it's discretionary dollars that you can use as a community based on what you decide. And youth were really not robustly addressed in Measure 110, and for good reason. I mean, Measure 110 was targeting you know, people that were being arrested for carrying hardcore substances. So it wasn't necessarily targeting the youth substance use disorder system. County financial assistance awards, which I think are funded in part through alcohol tax dollars. We receive Service Settlement 66, Service Settlement 63 that helps us do some substance use disorder intervention. Very specifically targeted dollars, rigorous reporting. Much of those dollars only targeted to individuals that are not recipients of OHP. So there's some extra hoops that we jump through reporting, and we talked a bit about that. So I won't belabor that, but that is usable funding, and we use it for a lot of our peer delivered services and contracts with substance use providers.
Janice, do you want to take questions as you go, or wait till the end? I think we have one question online.
Oh,
we can
sure.
wait
I
for the
only
end.
have 2 more slides, so I'm happy to take a question.
Jana, did you want to hop in with a question? Oh, maybe she didn't. Okay. Maybe she didn't bring it up. Keep going.
Yeah, and this, the way the slide loaded in your system doesn't have the same colors as mine, so I will have to talk you through what's accurate there. But this slide specifically represents the targeted alcohol tax revenue that comes to the community mental health program. So you see the amounts there. It was 199 actually expended in fiscal year 22, 161 and actually expended in fiscal year 23. And then 177,000 budgeted for fiscal year 24. So our community mental health program has an operating budget of about 50 million. So that gives you a sense of the scale of that investment in services. I would say that 10 to 15% of the people we serve have a documented alcohol use disorder. More of the people we serve have documented alcohol use disorders or polysubstance use disorders than opioid or methamphetamine disorders. So it's still more prevalent, just for all the reasons that everybody's probably very familiar with, than some of the other diagnoses for substance use disorder in our system. We spend that money in very specific ways. We have targeted 66% of it, which is what that graph on the right should show you, for intensive youth services. Because that is an area that's so underfunded, we took the bulk of our, in terms of substance use disorder, we took the bulk of our targeted dollars and put them towards addressing youth substance use on our intensive youth services side. So services like a drop-in center, kids who aren't our clients. In many instances, we serve about 700 to 800 kids a year. Most of them do ultimately engage in services. Many of them are unhoused. Many of them are struggling with substance use disorders. So that's one area of service that we target those dollars to. We target about 30% to intensive adult services and 4%, which equates to about $4,000 a year to our rural hubs. It's just a place to try to have some integrity with the intention of the dollars and put it where we know folks will show up. $177,000 covers about 1 FTE plus some indirect costs. So we employ 276 folks. So this really is a drop in the bucket in terms of addressing what we experience on the ground with substance use. That is me, that picture. I put it there on purpose. And I'll tell you why. I think groups like this often hear from people they see as bureaucrats. When we are in small communities providing mental health and public health services, we're next to our people in the field. We watch the impact of substances in their lives up close and personal. This is not an intellectual exercise for us. This is a visceral reality that we're working in every day, and our people are. So what we need, you're always going to hear from folks like me who have worked in the public sector their entire career, is that what we need are resources, and what we need is respect for our intelligence, our dedication, and our commitment to our service population. What that looks like is unrestricted funding, trusting us to invest those dollars where we see them needed. We believe we can be trusted. We believe we've shown great evidence that we can be trusted. We know that when we have unrestricted dollars to use as match to grant opportunities, it's an incredible opportunity for us. And I can give you pages of ways we've used general funds and unrestricted funds to match federal dollars in ways that really resulted in expanding resources in our community. So while I have no recommendation at all about what this group should do with alcohol tax dollars, what I will say is when you direct dollars to the public sector, please do ensure sustainable mechanisms of predictable funding. Please do allow flexibility for local innovation. Please do consider that we have indirect costs just like everyone else. And if we can't pay them, we have to rob Peter, which is probably a client service, to pay Paul. So account for that. Please avoid overly restrictive fund size fits all requirements. Rural Oregon does not look the same as the Valley. And additional duplicative reporting under the guise of accountability, which actually focuses on widget counting that no one reads and not on outcomes, which is what we care about. Thank you.
Thank you, Janet.
Yep.
I know we have 4 more presenters.
Okay.
So let's try, Vaughn online has a comment, and let's just try and keep questions brief so we can get through everybody. Vaughn?
I was just wondering if you can talk about, I know you said that you have a prevention program for kids. I was just wondering if you can talk about your interaction with the school district and whether or not that prevention information gets shared. I've just heard a lot about the lack of kind of standardized prevention education that's out there right now. So curious on your experience.
We have several school-based prevention programs. We have a program called Upshift, which is a small program very much focused on kids who are about to be expelled because of substance use concerns. And then we have a program called Healthy Schools that provides an evidence-based prevention curriculum in most of our middle school, and then our feeder middle schools and our high schools focused on safe relationships, healthy choices, substance use, avoidance skills, resilience skills, all of those things. They've really gotten recognition around the state. Both of those programs have been quite effective in teaching teachers how to use evidence-based curriculum to do prevention with young people. The Healthy Schools program is at risk. It's funded right now half by the school district, which is struggling, and half by county general fund. And with county general fund declining, we know that we may be in a position next year where a 4-year pilot will end. That's 9 staff, that's hundreds of kids that have been served. We're constantly looking for resources to sustain programs like that.
Aaron.
Aaron Sarnoff, 2 towns. Looking at state funding for SUD expenditures, it's increased by about 150% since 2021, more than $1 billion. And I was just curious if your county had seen any significant influx. It's a substantial increase in that department, in that segment of spending, and I was hoping to see some positive impacts where you are.
We have seen a significant investment on the part of the state in behavioral health dollars. And then obviously Measure 110 was a huge influx in resources. And I think the Measure 110 dashboard tells the story with you. There's been great knowing of success in engaging people with substance use disorders and assessing them and referring them to treatment. We certainly have been able to add staff, but part of how we've added staff at our county is that we're also a certified community behavioral health. So we've used general fund and other investments to shore up that effort, and then we're able to draw down enhanced federal reimbursement rates. So we've been very fortunate in Deschutes County that way. But yes, there's been a significant increase in investment, which follows about 30 years of underinvestment in the behavioral health system. So what I'd say is we're better than we were 5 years ago. We are still playing significant catch-up.
And I just want to add that Measure 110 money goes toward recovery and treatment, but it doesn't go toward prevention. Is that accurate?
It doesn't go towards prevention at all. Yeah. I mean, that's really that's a huge gap right now. services, so.
Thank you. Let's go ahead and move on to Steve, so we can get everybody in.
Sure. I will try to, I'm Eve Gray, Director of Health and Human Services for Lane County. And I will skip over points in my comments that have already been covered in the interest of time. Certainly have similar comments as many of the other presenters in terms of what is happening in Lane County. So we have definitely already covered the splitting of funds, alcohol tax dollars, in particular marijuana tax dollars. Currently, our general fund receives $2.6 to $2.8 million per year for alcohol tax revenue and about $500,000 a year for marijuana tax revenue. The vast majority of our general fund, we have a permanent property tax rate as low as Deschutes County, but we do not have the public safety districts that Deschutes County has. So 75% or so of our general fund goes toward public safety. That is inclusive of the sheriff's office, the district attorney's office, community justice and rehabilitation services, which is parole and probation and youth services, and a small amount of behavioral health. We get just a tiny bit of general fund to support us with civil commitment investigation, which is an area that's been very underfunded. So when you look at the total general fund investment of hundreds of millions of dollars, and 75% of that goes into public safety, that is where largely our alcohol and marijuana tax dollars are going, certainly addressing the street level impact of alcohol use in driving under the influence, and both the offense and the crashes as a result of it, as well as responding to crimes in progress that maybe would not have happened or would not have happened as severely without the influence of alcohol. So that's where our general funds, our flexible funds go. We also do, just like other counties, receive dollars into health and human services from the state, little bit into public health, just like everyone. Dr. Lundke presented on that, and also through our county financial assistance agreement, through the alcohol and drug service elements of that agreement, of which there are many, and we appreciate all of those dollars for sure. What I will make one comment on marijuana dollars before I move into how we utilize our alcohol and drug dollars, which is you'll hear a similar refrain here. We used marijuana dollars to fund prevention positions, 2 FTE in public health. And when we lost the dollars, they went to behavioral health resource networks. Certainly an increase in services in our community. In our community, the behavioral health resource networks are separate from the county, and it is difficult to coordinate. So there is an impact there in terms of our ability to be as streamlined as possible in the provision of substance abuse treatment services. So we have seen an increase, but we saw a dramatic decrease in our prevention capabilities, particularly in the substance abuse disorder space, with the reallocation of those dollars. So just reinforcing what you have heard for sure. For the alcohol and drug funding within our county financial assistance agreements, it is very, very, very specific in terms of how it can be used. So, for example, alcohol and drug 66 or A&D 66 is a service element that has, in our county, it has the most funding available in it. I believe that it is from primarily substance abuse tax revenue, or substance use tax revenue, alcohol and marijuana, but I would defer to OHA for all of the ways that A&D 66 is funded. And what we are identifying is difficulty getting our providers to sign on to contracting with us to provide services under that service element. And it is because we can only provide services to uninsured individuals, of which Orphans does amazing work. you know, we have a really low rate of uninsured individuals. That's fantastic. I'm really happy about that. We never want to see that changed. But the insistence that the dollars that come to our community are focused on uninsured individuals may not be meeting the needs as time goes on. From a local perspective. The other challenge is that for these particular funds, you have to collect 14 different performance measures for all of the people that you treat. And so given the small population that can be served with the funds and the intensive data collection and reporting requirements, what we are seeing is providers turning away from the CFAA funds and toward burn funds. Which are more flexible and easier for them to provide services with. So that is certainly in terms of when I think about, do we have enough dollars flowing into the system? Seeing where we are starving everywhere, and we are also seeing revenues climb at a significantly lower pace than expenses. We have constitutional limitations on how our property tax rates can grow. And expenses continue to rise very, very rapidly. Last year, we were facing a $7 million gap in our general fund that we had to close, and it will be bigger next year because the cost of providing these services is just rising so rapidly. And that includes services related to substance use. And substance use, substance abuse, both have costs. I also, much like the other speakers, I am a member of local wine clubs. I support my local wineries. I have family members who own breweries. We care deeply about the business within the state and see all of the wonderful cultural things that are brought. I'm also a registered nurse, and I have been by the bedside of people dying of alcohol-related cancers and alcohol-related dementia and other types of problems, not to mention folks who die in automobile crashes that wouldn't have happened without the use of substances, particularly alcohol. So it's both sides, and all of it is important in this conversation, really thinking through how do we fund the response to excessive alcohol consumption while also really supporting the culture that we have in Oregon. And that is you all's challenge to solve, not mine. But I also wanted you to hear that I'm not coming here as an advocate and talking about these things while saying that we do need more resources in order to continue to respond to the use of alcohol and other substances within our communities. So just a couple of things beyond the increase in resources that are similar to what Director Garceau was mentioning in terms of what else could we do to be more efficient with the dollars that we have. We want to do that. We want to be accountable as public agents for sure. So I think that what you're talking about in terms of improved coordination, really opening the doors about where all of the dollars are allocated makes a lot of sense. What I would ask is that those reporting requirements be simple and generic. So these dollars go to public safety and it's these components of public safety, or these dollars go to behavioral health or public health and these components. Those are easier reporting requirements that we can do without hiring a whole other FTE. Reduce other administrative burdens of reporting. We really want to engage in a conversation about how we demonstrate our level of accountability without all of the metrics associated with it, because I do hire a small army of analysts who do all of the reporting requirements on private, state, and federal grants. And we utilize all of those resources. For me, because our general fund is so low in Lane County, only 2.6% of my budget is general fund. Everything else, I have very intensive reporting requirements on. And that makes it hard for the dollars to go to the service that we are trying to provide. Increased flexibility, I have that same recommendation, particularly within the CFAA and A&D 66 in particular, but I would say all within the CFAA. If we can utilize the community health assessments that we already perform and then demonstrate that we are applying the dollars to our community health assessments in both the public health and behavioral health side, then that would just allow us the ability to respond to our community's need in the way that our community is asking for us to do that. And similarly, the more local control that we can have over these dollars, the better in terms of utilizing our CMHP, community mental health provider, and our local public health administrator in order to really guide, direct, and to have the expectation of coordinating the services in order to break down those silos. I think that if we can do those things, we can make sure that we're using the dollars that exist in the best, most efficient way possible. And I don't think it will be enough, just very honestly, because of how expenses are increasing. But I think it's both and would be what I would propose in terms of having a balanced viewpoint.
You have a question? All right, Molly, you are up next. Oh,
Prince might have a question.
do you have a question, Director Prince?
Oh, I did have a question, Annalise. I know you're going. And before I ask, I just wanted to, we were dealing with some task force work and talking about timelines. I just want to say, I'm sure this is on behalf of all of us on the task force, just thank you all of the county folks that are the direct line of services for people in recovery, people who need treatment for excessive use of alcohol or for use of substances. So we were caught in our moment this afternoon. I just want to say thank you to everyone who's presenting today. It means a lot. And Tom, you might don't understand what when the 66, just because I want to clear up these revenue distribution streams. What is that reference to that Eve made? Eve, either you or Tom, the reference to that fund.
I brought that up, Director Prince. I wondered if folks in the room knew. Does somebody want to do just like a 1 minute on the county financial assistance agreements? We, on the public health side, I think we may have done a little bit better job with the public health contracts, talking about on that side of the program element. So folks have heard about that, but not the service element.
The service elements is like a program element on the public health side, and it is a terminology for the different streams of dollars that come through the county financial assistance awards that come to county community mental health, well, to counties to do community mental health work. And there are 130 some potentially. Some are specific to substance use disorder treatment, and they are funded through, they could be funded through Medicaid dollars directed towards substance use disorder treatment, through state general funds directed towards substance use disorder treatment, through alcohol dollars, which may come as state general funds. I don't know OHA's sort of budget streams. And typically they're in service element streams because often there are rules associated with a pot of money. And so that means in my agency, between public health and behavioral health, we're managing 130 different contracts, most of which have reporting requirements that are intricate, individualized to that service element, and financial reporting associated with that. So that's why you hear Eve and I talk about administrative burden and the cost of such a complex system that takes dollars out of circulation for treatment, which is what we actually care about, to do a lot of other things that I think other folks care about too, and I don't want to diminish it, but could be more simple, way more simple. Way.
Is that good, Director?
Yeah.
Yeah.
That's good. And so the follow-up, just so I think everyone understands, the money that goes directly to the county general fund it doesn't have those type of restrictions, does it? Or I'm thinking of the general revenue for the county.
You are correct. Our flexible funds primarily go to public safety. And that is because we have funds coming in other ways to behavioral health and public health, but they are much more restricted. Yes.
And you talk about the Deschutes County distributed, same topic. And it's in the slides.
I just say, Annalise, I appreciate both of your presentations. Thank you very much. And I hear what you're saying in terms of loss of revenue, property taxes, increased costs. And that's honestly been our argument on the industry side too, because it is really tough to do business right now, especially in the state of Oregon. We've lost over 20 brewers just in the past year. And that's not just excise tax revenue that's lost to the state. It's income taxes, it's employment taxes, it's all those people having jobs and spending in our communities. So it's really difficult to look at this when you're just focusing on one thing, because it affects obviously the whole ecosystem. So I think there are similarities in that, we're feeling inflation and everything else too. We have workforce issues too.
Yeah.
So.
Yeah. And all of our workforce are tax-paying folks.
Right.
So we don't want to lose them.
Yeah.
I get that. I hope it doesn't end up being a lose-lose.
Thanks, everybody. So we've got 3 more presenters to get through. Molly.
So Molly is in a meeting with Rep. Walters and Rep. Reynolds currently, but she's not the Washington County Department of Housing and Services Director. So we may be looking for somebody else. She's the Wasco County Youth Services Director.
Is it somebody here from Washington County or is that? No, this is an old version.
Okay.
Yes.
Okay, so we're rolling right through them. So it's our Roscoe County folks. Al, are you gonna present?
Yes, I can present. Can you all hear me voice-wise?
Yeah.
Great, thank you. Yeah. And I did share a presentation with the group. Thanks, Chair, and thanks, group, for allowing us to speak again. As Tyler mentioned, he shared sort of the county perspective, and our presentation will discuss a little bit about things in the Mid-Columbia region. Again, I'm Al Barton. As I'm similar to my colleague Janice, I'm a licensed professional counselor. I still work in the field. I've been at this for about 30 years, and I also have lived experience. I have a stepbrother who died of an opioid overdose, and then I have a beloved cousin who died from a substance abuse related issue as well. So this, comes to me personally and professionally as well. So again, beautiful picture of where we all call home in the Columbia Gorge. Again, mine will be a little broader because, as Tyler mentioned, we're the community mental health program for 3 counties. So we stretch west to Hood River County, which of course touches Multnomah County. We cover Wasco County, Sherman. It's about 50,000 lives. Because we're on the river, we do obviously see folks from Washington as well, but it's a geographical area about the size of a little bit bigger than Delaware and Rhode Island combined. So it's a large space with not many folks. Anyway, next slide, please. The nice thing about following my colleagues is I can just check off a bunch of boxes in terms of saying ditto. So I'll skip over the pieces, but in terms of the administrative burden, the prevention issues, the lack of focus on youth, the increased use of opioids, and the lack of residential services. So I'll just piggyback on my colleagues who shared before and skip over those, but we would just check the box and echo those concerns for a small community mental health program. As Tyler mentioned, we are kind of unique. We're an ORS 190 organization, which means we are a government entity similar to our regional jail. It's organized as we're a 3-county, the jail is a 4-county. We provide as the community mental health program, similar to what Director Garceau was talking about. We provide community mental health program services, which include crisis. We work with a lot of severely mentally ill adults and obviously a lot of our intensive youth services. Similarly, we're a certified community behavioral health clinic that has leveraged us in the past to be able to subsidize some of especially our medicated-assisted treatment program, which is an outreach program and a medication program for folks struggling with opiate use disorders. We also provide driving under the influence both education and treatment. We're the sole provider for our region. If folks incur a driving under the influence charge and they may need either education or some folks actually need drug and alcohol treatment. We operate a very small but mighty drug court. And then again, as a community mental health program, no one's turned away for lack of ability to pay. So we have sliding fee services. We have a lot of folks, either because of their employment status don't have health insurance. We also, about 30% of our folks in Hood River County speak Spanish. A lot of folks are never going to qualify for the Oregon Health Plan. So we do offer sliding fees to fill in the gaps. So next slide. This is sort of a bit of a confusing pie slice, but again, it will, I think, speak to some of the concerns that some of you raised. So again, as Tyler mentioned, all the county financial aid assistance awards and all of the direct contracts with the state come through us as the community mental health program. So we're sort of side by side with the county. So a little different than my colleagues in Deschutes and Lane and Washington. So you can see the big orange pie slice there. Again, we much appreciate the behavioral health resource, the Measure 110. That really was a huge infusion to a drug and alcohol service program that many, many years had to borrow from other service areas, is similar to what my colleagues talked about. So the burn was, and again, there are other service providers in the region that share. We actually have 3 burns. We have one for Sherman, one for Hood River, one for Wasco. And in each of those counties, there are other professionals and organizations that get some of that funding, but you can see it really propped up a chronically underfunded drug and alcohol services. So on about a $2 million drug and alcohol budget, it's just over, almost 60%. So there's some little pie slices there. The gray slice to our left, hopefully you can see the numbers there. Apologize for if it's kind of small, but that's our county financial aid assistance award. So again, it doesn't go through the county, it comes directly to us, and that's about 20%. 16% is we have to go and hustle. We have to get individuals into services. They have to show up. We have to bill a service. Our coordinated care organizations, our insurance companies, they have to pay us for those services. So, about 16% of our services, really, we have to live on what we can get folks in the door and into providing a service that they find valuable. And then there's some very, very little pie wedges. Folks might pay as low as $10 or $20 for a service, depending upon their income. There's a very small little slice that we do get from the counties, from the beer and wine tax receipts. And then we do provide, we do have a separate CCO, coordinated care organization, for Sherman County. So just a very almost minuscule pie slice there. So anyway, just gives you kind of a funny picture of how we provide funding for drug and alcohol services in our area. So next slide. And I will catch us up. So again, here's just briefly, it scooted over, but it all looks okay there. This is our County Financial Aid Assistance Award and how it's broken out. You can see that there's some monies that are dedicated towards peer services, and that has just been a lifeblood for us. But as Director Garceau pointed out, $34,000 doesn't even begin to pay for an FTE. We probably have 12 or 13 recovery mentors, and so we have to find other ways to fund those super invaluable folks. They're co-located with probation. These are the folks that go on the street. These are the folks that have lived experience. They were really a lifeline through the pandemic for us to provide services. We do get some money, obviously, for just straightforward drug and alcohol treatment. And then I did lump in problem gambling, even though it's not probably technically the purview, but it is a decent chunk for us. So you can see, that $400,000 for 3 counties is supposed to cover drug and alcohol services. And again, none of that's earmarked for youth, but we are really successful in starting our first. We collaborated with Molly Rogers, our probation. She sent us a drug and alcohol service provider referral, and she's going to provide, she's about 0.6 for us. But so youth has always been kind of lagging behind. But that's how the money, from the state direct contract goes. And to answer a question, yes, it did increase about 9% over the last year. So we are appreciative of that. We also became a dually credentialed provider, and there are some incentivized ways we can bill for higher rates. So that was a huge, long overdue. We really applaud the state for allowing, our providers to serve both alcohol and mental health, because it's very rare to find someone who just has a mental health or just a drug and alcohol. Most folks are going to have that co-occurring, as the doctor suggested, issue. So we're really happy to see those incentives and see the state leading the way and also providing some support to be able to pay for that. Next slide. Here's our challenges. Again, these are probably quite similar to many of our colleagues. I apologize. You're going to have to just hit. You can just hit all the way through because they're sort of animated here. Workforce for us, we experience here in the Gorge a 27% vacancy rate. This is, again, all of our services, not just drug and alcohol services. We have chronically underpaid our drug and alcohol staff. We just did a recent pay equity study, which is going to hopefully, we're about to finalize an agreement with our union to make some notable investments for them. So, and then obviously for us, we have to compete with telehealth providers. There's a lot of demand, a lot of acuity for us. You know, we're one of the few, especially for those acute clients, especially those severely mentally ill folks. As my colleagues mentioned, administrative burden, you know, the staff required to run reports, to provide output to services is legion and a real challenge for us. And then for us in the Gorge, it's a beautiful place to live, of course, but it's also very expensive. And so for outside folks to come here, there's a lot of sticker shock. So I think that's about it for me. I know Molly Rogers raised her hand, so I'm going to let her chime in. Happy to take questions either before or after. And again, just honored and appreciative. I'll just piggyback on what my colleagues share. So, like, there's a couple of hands. I don't know if Molly, you wanted to chime in first or hear from the.
Yeah, why don't we, it looks like Rob has his hand up. Rob, do you want to ask a quick question? And then I'll just note that the other two folks are also from Wasco County. So maybe we can, Rob, if you want to ask real quickly, and then we'll roll through the rest of them and then do questions.
Yeah, thank you. My question is for Mr. Barton. Mental health is kind of an underlying factor, in my opinion, to a lot of the addiction issues that we face. We're tasked with taking this kind of a holistic look at the problem and make recommended solutions. And my question for you is, are there currently any regulations that exist in your field that might, if they were changed, would have a significant impact on your ability to be able to address substance abuse disorder in this state?
Al, do you want to respond to that? It's a big question. Oh, you know what? Yeah, it's Rob. I think Al was having some issues with his stream.
Janice might be able to answer.
I might.
In like 3 minutes. I know we may have to take that one.
It's a huge question.
Yeah.
It's a huge question.
Al's back.
I apologize. My internet, of course, perfect sign. So I'm on my phone. I apologize if I missed the call and can answer the question. So.
So Rob, do you want to repeat your Rob had a really big question about administrative burden and if you have a recommendation to remove.
Let me see if I can, let me try and make it smaller. Al, in your opinion, are there existing regulations that, if enacted, might assist in the state's ability to address substance abuse disorder for this, that this committee might consider as a recommendation?
Yes, there are. I think, you know, there's been a work group that's advised the Oregon Health Authority. You know, my biggest beef is that, you know, we really want, there should be measures. No one says there shouldn't be any reporting and accountability for, especially for taxpayers' dollars, but, you know, they really should be driven in my mind about outcomes that direct patient care. You know, there's a lot of reporting that if you ask the patient, the client who's involved in resident in our services, they wouldn't have any clue how that benefits their treatment, right? That those are reporting on some demographic types of things. There are some sort of state reports that require demographics. There are some burdens about how often we have to review services with people, like service plans and assessments to be done. They're not really driven necessarily by what the clinician and the client see as best. They're driven by timelines. You know, they're sort of, oh, it's that time of the quarter, we have to review this plan for you. So I think there would be some real improvements in terms of those types of things. It's also a real challenge. You know, if you came into our services and saw the intake packet that we required, we've tried many, many years to make that thing smaller, but it's still 29 pages long. And again, it's not driven by, if you as a patient, you're going to say, okay, I see about 3 of these pages really affect me as a patient coming in. Most of this other, why do you want to know all this other stuff? So, you know, and you just add those types of things up, it becomes sort of they seem, it's sort of death by 1,000 paper cuts. I mean, in and of themselves, they're not, you know, demonstrably overtly time consuming, but when you add them up, they make for a difference. And if when we've seen exit surveys of clinical staff departing, one of the main reasons, you know, obviously another opportunity to work with less acute folks, but really the paperwork requirement and the documentation requirements are kind of onerous. I would really love to see, there were some really clear specific guidelines. The Association of Community Mental Health Programs, there was a work group that really gave some concrete and specific requirements. So I would deflect a bit, and I'm happy to produce that. I can ask the director to produce that for this committee, which are some really concrete because I'm probably not going to be able to recall all of them off the top of my head, although perhaps Janice could, and she might chime in on this question as well. But I appreciate that. That is within our control, right? We can't control how expensive it is to live here. We can't control the acuity of the clients, but we can control what we expect professionals and organizations to do and report on. So that's my soapbox.
Thanks, Al. We only have 15 minutes left, so I'm going to make sure there's time for Molly and Sheriff McGill to chime in. Molly, did you join us and want to chime in before we turn it over to Sheriff McGill?
I can. I to lead into Sheriff McGill is kind of an honor, I have to actually say. My name's Molly Rogers, and I'm the director of the Department of Youth Services for Wasco County, and have been in the role of juvenile director in the state of Oregon for the past 30 years. I started out in Wallowa County, and then came to Wasco County about 22 years ago. I also am past president of the Oregon Juvenile Department Directors Association. So my perspective that I'm bringing to the table today is just an advocacy to lift the voice of youth. And youth who are, we know that 90% of youth who enter substance abuse or dependency come through the door of alcohol, not blaming alcohol, but that's just the socially accepted way, especially in the rural counties. And the services and SUD services across the state of Oregon for youth is not a system. Al was very kind to mention my name in bringing a substance use treatment provider to Center for Living, but that was simply because I finally just had to grow my own. And one of the challenges for the youth system is that the prevention side of the system is not funded through a Medicaid model. And so we have to wait until there's some sort of entry point into the system for systems to be able to access funding for or reimbursement for. And so truly today, my piece is it's a partnership between the counties and the state to provide prevention services. And since the 2001 kind of massive special sessions, it definitely has felt like the responsibility for prevention and youth engagement has fallen really to the counties. The question about mental health leading in, we know that oftentimes youth enter our system with substance use that's coping with a previous mental health or lack emotional. And we're really learning that more and more around emotional literacy and the connection between those two components, as well as genetics, but also truly just, we put a lot of pressure on our kids right now. And so youth were left out of Measure 110. We tried to bang at those tables and we were unsuccessful. And each table I get to, I think that it doesn't matter which table, there's lots of different pulls and pushes. What I do know is that I'm lucky in Wasco County that we were able to make an arrangement with our marijuana funds that we do have some focus on prevention. And our prevention efforts in Wasco County over the past 5 years created a program in our schools. And I will tell you that we dropped our referrals to my department based on that program by 68%. That is a phenomenal rate reduction of juvenile justice referrals over a 5-year period of time. So I'm really lucky that Wasco County will invest in youth services and prevention. I know that there's 35 other counties that varies across the state. And some counties, again, when we did our burn, Al knows we were pretty advocated to put youth at the table. But again, out of our 3 counties, there were not a lot of other counties that did that same model. The other is we know that we can intervene with youth prior to any kind of dependency to either do one of 2 things, help them completely find abstinence from, or also find the capacity to be healthy with. And so that really has been and we've used the SBIRT, the Screening, Brief Intervention, and Referral to Treatment model here in Wasco County to do that, as well as Clackamas County has been very successful in creating SBIRT in one of the schools. I think it's the Gladstone School. I think it's Gladstone, as well as with their assessment center. So those are really kind of my highlights, and I'd be love to answer questions if they come up, but I want to make sure that Sheriff McGill has the last 10 minutes.
Thank you, Molly. Sheriff McGill, it's all yours.
Wow, thanks, Molly. I appreciate that. Can everybody hear me okay?
Yep.
Good, thanks. Well, hey, thanks for inviting me and for the conversation. And I was asked to talk about the cost to law enforcement. And when I really got to thinking about it, is I kind of really thought about the true cost to law enforcement. And yeah, as Tyler alluded to earlier, one of his bullet points is, there is a cost to law enforcement from, our responses and things like that. And when I say cost, I'm talking financial. But I think one thing that we often forget is the actual cost it is to our agencies through public safety and the impacts of our responses to, the needs of our community when we have to be focused on a lot of different things, especially in this business. So if you look at just the cost of just any kind of call that's related to alcohol or drugs, one of the things you have to understand is I'll just use a really good example. I think we're all very, very familiar with this, is the DUI investigation. The complexity of DUI investigations and the time that is consumed by deputies when they just investigate a basic DUI arrest, let alone get involved in a situation where they have a fatality or we have a situation where we have a crash or something like that. The really short statement on the DUI side of it in that example is the reality is every time I have a deputy initiate a DUI arrest and investigation, we lose that deputy for almost the entire shift, if not multiple shifts based on the complexity of that investigation. What that does is that, and that's not just the investigation, so that has a ripple effect through our system if you think about it. So now you've got court stuff, you got jail stuff, you've got all the things that come after that. So what ends up happening is when we look at drug and alcohol, in particularly in our responses to it from a law enforcement standpoint, they takes up tremendous amounts of time and stuff like that, which the reality of is that creates gaps. For me, and particularly in Wasco County, I know a lot of other sheriffs in the state of Oregon right now, even on day shift. Actually, I'm pretty fortunate today. We had 3 on shift, but I never hardly run more than 2 on shift at night. And so if somebody's in doing a DUI investigation or a drug investigation or something like that, what it eventually happens is we have one person to respond to those calls while we actually have 2, but what that does is that takes away from the actual getting that DUI investigation, those reports done for the courts and different things like that. So those are the gaps that come from just that. That doesn't include substance use disorder and stuff like that. And I'll get into that in just a little bit, but it's the other thing that I think that we often forget is we do talk about alcohol a lot. And I know that's the focus of this group, but a lot of people have talked about substance use disorder and things like that and co-occurring. And I could probably go on for more than my remaining 7 minutes about substance use disorder, dual diagnosis, co-occurring, and those types of things, because really the reality of it is they both impact everything. And so, but with that being said, I just want to tell you the impacts. I'm the Oregon State Sheriff's Association chairman, medical examiners board chairman to the Oregon State Medical Examiners Board, which is a governor appointed thing. And just so everybody knows, we meet every year, and I'm on a work group for the medical examiners group. But in 2022, there was 433 deaths due to the effects of alcohol consumption, which is an increase of 99 over the previous year. The interesting part about that conversation is 200 of those deaths were due to acute intoxication. But what we often forget is 172 of those cases were actually dual intoxication. So it was not only alcohol, but it was primarily fentanyl in that particular thing with a combination of other stuff. The reality of it is drugs and alcohol and drugs impacts us and impacts you. As a matter of fact, we contracted with the Cooney Institute to do a frequent utilizer program, and it was a 2-year study through them with Norcor, which is Hood River, Wasco, Sherman, and Gillum County. And I'll just read these statistics to you. And the statistics were taken, and I can tell you they've increased. The statistics were taken from January 1 of 2021 through December 31st of 2022. So just let ring true with you. Frequent utilizers are in two categories. One, we have 3 and they've been arrested and they're in jail 3 times. And then we have frequent utilizers that have been in jail 4 times. In the individuals that have been 3 times or more under frequent utilizers, 47.5% of those have a substance use disorder flag. 23% of those are alcohol, 41% are drugs. If you go that and bounce that up to 4, it goes from 47% to 53 and 23 to 21 respectively. It actually slips a little bit on the alcohol side. But here's the interesting part. The drug flag goes up to 49%. What we don't, and then if you move that down into the percentage of each group that uses those substances, and I think this is important for LCC to hear in this work group, 24% of those cases are directly related to marijuana use, cannabis. So yes, cannabis affects and impacts it. As a matter of fact, if you move it up, it's interesting, percentage of each group identified as having substance use disorder using those substances of each choice, the 3-person frequent utilizer bounces to 60.3%. Let's not sweep this under the carpet and let everybody know that the reality of it is that cannabis, drugs, alcohol, all of it, it's a dual diagnosis. It's multiple things that do that, and it impacts all of us. And we have that triple effect, trickle down effect. And why do I bring the jail up? Because every Oregon sheriff is responsible to have a jail. And we have people in our jails that are using up, we have drug and alcohol addiction counselors. We have all these things that we have to do in our jails, and it's taken up a lot of time, a lot of money and stuff like that. But I want to make sure that we understand that we can't really, in some ways, we can't really put a price tag on it. Not that money isn't important and we need to invest in those types of things, but I think we have to think about it from a kind of a 2-pronged approach. Well, yes, funding is important. The other part of it is education. And I really want to piggyback on what Molly was saying. And I know other people are saying this, but the youth of our state are the next generation and next generations, and we need to invest in that. I'm super proud of what we do here at Wasco County and the reduction of those intakes through our juvenile department. It's a powerful statement to show that when you invest, the return on that investment is huge. I mean, I don't think there's any other county in the state of Oregon that can say that. And the reality of it is when you provide evidence-based programs for that sort of stuff and you fund them correctly, you get results. And they're not just short-term results, they're long-term results, and we see that. The other side of it is we need to look at it from a treatment side on the substance use disorder side, even in the adult side, and think about the youth and you think about adults. If you create a system and you fund a system that creates treatment options on both sides, as well as education on both sides, eventually those gaps will begin to close and you will merge that. And the ultimate goal would be to eliminate all of that. We know that's probably, well, that's unicorns, rainbows, and Skittles. And I'm not into unicorns, but I do like Skittles. But I'm just telling you right now, the reality of it is if we invest in those types of things with the reality behind it, we can fix a lot of the problems. Enforcement is important, don't get me wrong, but we have to create balance with treatment options and those types of things. So I think that's about all I have to say, and I'd be willing to take questions.
Sheriff McGill, would you be willing to share that report with us that you were taking the numbers from?
Yeah, we have the CUNY report.
That would be amazing.
Yep, I think I can send that over to Jessica Pratt.
Thank you. Do folks have questions in the last minutes here?
And Chair, I'm gonna take a little bit, just 30 seconds, just to acknowledge that oftentimes we do see a lot of people here, an incredible amount of speakers, and they're collaborating and in sync. And I don't think in all these meetings, the 11 meetings we've had before this, we wouldn't be able to do it without the collaboration of staff. And I just really want to give some kudos to Jessica Pratt from the Association of Oregon Counties. She's been working and collaborating and communicating and over communicating. And so I just really want to thank you for that. I will go back and make correction. I know we were doing some last minute changes, but she's been an extraordinary resource to get all these great folks here. So thank you.
Likewise.
last questions or comments? Well, thank you. Rob.
Yeah, I don't have a question. I just have a request. Al was a speaker earlier, and he mentioned that there was some data around some committee work that had been done around policies and procedures at the state level. If that information could be shared with the group, I'd appreciate that.
That's the admin burden task, the tackling admin burden work group, and there's now a bill that actually supports a task force that is working to address that. So I can connect you to that.
Yeah, it is not up and running yet, but as I understand it, the contract is almost out to
Yeah, and
the
they're
Council for Behavioral Health.
the transition is happening.
But yes, we can, I just reached out to the executive director at AOC, at Association of Community Mental Health, and we can make that information available. And I guess I'll just send it through Jessica or to the facilitator who sent the email.
Yeah, if send it to OLCC, that would be great. And I think we had one presenter earlier, Eric maybe, or maybe Tyler, that presented on your own. If you can make sure you get those slides to the OLCC folks so we can ensure it's part of the record, that would be great.
Thanks for the time.
Sure.